Did you know you can use clear aligners to create space for implants, to achieve expansion, and even improve periodontal health? Yes, you heard that right. These are just a few of the powerful techniques that we cover in the Clear membership. Hi, I'm Dr. Stefan Reinhardt, Director of Education at the Clear Institute, and today I'm giving you a front row seat to some of the most impactful lessons from our exclusive webinars. These are insights designed to solve real-world challenges in your practice, from rotating molars to answering tricky patients' questions about finances. What you're about to see is just the tip of the iceberg and what our members have access to every month. So let's start with how integrating CBCT into your ClinCheck can revolutionize your clear aligner treatment planning. And at the end of this video, I'll share a special offer that makes joining the Clear membership the easiest decision you'll make this year. Plus, you'll find links directly below this video for the Clear membership, as well as for the Master of Clear Aligner program, our MOCA 101 and 201 program. So if you're ready to commit and finally understand how clear aligners work, those programs are for you. These resources will give you the confidence not just to start cases, but to finish them to your satisfaction, because like every dentist I know, you're a perfectionist. So without further ado, let's dive in.
I discovered the CBCT. Since Align integrated that in the ClinCheck software, this is something that helps me so much. I mean, the pan gives you an overview. It shows you a little bit, okay, there's a root canal treated tooth, so I have to take care of this. There might be, maybe an implant or whatever. I mean, this gives you a really good overview to just have the first check. And this is always what we have. And after I looked at that and see the intraoral conditions of the patient, I decide a lot of times, do I need more or not? Mm-hmm. If you see that, for example, I mean, that was a tooth we decided it's going to be extracted. Yeah. Right? Patient would go for Invisalign after. Mm-hmm. So, and I told myself, well, it's pretty obvious there's a lot of bone loss. Mm-hmm. But the patient wanted me to close, after we're going to extract that tooth, to close the gap with orthodontic treatment. And now it's not the question about braces or Invisalign. It's about, am I really able to do that? Is there going to be, because it doesn't give me any information. I see like there's nothing, but there could be maybe still some bone, because you don't have like the depth, the 3D in that. So I told myself, let's do that CBCT. It's really easy to integrate that into the ClinCheck software. There's just a little button that's going to ask you when you prescribe if you want to add CBCT. You just upload it. It's very, very easy. And then you see something like that. So you have the normal ClinCheck when it opens. So you make a treatment plan, whatever, but usually you look at the roots before. You have many options. You could say, I just only want to look at the roots, what is nice to see, but does not really make a lot of sense. You can have a semi-transparent view of the bone. There you already see there is a huge hole. I mean, there's not really bone. And this is where the magic happens now, right? Whatever you plan, I mean, you can have just that view all the time. You just can tell myself, okay, I will leave it like that. And now if you look what like the canine and also the premolar are doing, we still move those teeth, those neighbor teeth, but we now have the control that we don't move those teeth into that huge hole we see there. And I think this is something, it was never better controlled than that.
I look at this and I'm just trying to, again, be a detective. I know x-rays, nothing, but they want, of course, to put an implant here, right? We want an implant here. Like this. We're going to put a cuspid there to replace that tooth. But just by looking at this, try to figure where would be the root of that lateral. And I have the impression if you look at the axis, it's probably something like this. The premolar we don't see really well, but I mean, I have to check. I'm not sure already, just by looking at this, I'm not sure that we're in the right position to be able to put an implant there. But they finished orthodontics with brackets and and look here, look at the occlusion, so don't judge. Don't judge, because we never know what type of patient we have. We don't know the story. We don't know. Before judging, if you have something to say, call the other dentist, call the orthodontist. Just maybe sometimes I had some cases where the patient wanted to, they had to move, they have to change country, so they wanted the brace removed before. So we have to be careful with that, because we have a tendency to judge really fast. Oh my God, would have done a lot better. And sometimes it's the patient. Sometimes those patients, those class 4 patient. Yeah, I have class 1, class 2, class 3, and class 4 patient. Class 4 patient are patient you don't want to treat, because you're going to be married with them. The case will never be finished. It will never be satisfied. So you have to be careful with that. But so we don't know. You have to, if you want the story, at least call the dentist, call the treating dentist or orthodontist. But in that case, they didn't want to go back. They didn't want to. And I said, you know what? If you want to do something, we're going to check, we're going to take an x-ray, but there's surely, I'm already seeing other things that need to be fixed. I don't consider this case finished. And of course, we don't know where it started from. Maybe it was a lot worse. Maybe, again, don't judge. But for sure, I suspect here that probably the patient's not ready for an implant. So just, again, look at this. Look at this. Look, for sure, I'm pretty sure this is what we're going to see. And look at the x-ray. Look at what we're seeing here. I mean, look at the roots there. I mean, we have the premolar root going, like one root going like this. We have so of course we could check with the CBCT, we could, but there's a good chance we have one root like this. There's a good chance that we probably need to move what? Move the roots. What? Can we move the roots? Well, this is what we're going to see with that case. But for sure, again, we have to be these, dentofacial detective and look with our eyes open, not our eyes closed. So if we look in the ClinCheck, and look here again, the type of movement that you can do, try to figure out the type of mechanics. Think of the teeth like they're all in soft wax. How would you move them? Where would you push with your thumb, with your fingers, if they would all be in soft wax? Remember when we were doing our dentures, with the teeth and the wax and just moving the teeth? How would you move them? Where would you apply the pressure? If I tell you can use your thumb to move the teeth, they're all in soft wax. Where would you apply pressure? How would you move them? It's an indication. It gives you an idea of how you could use the attachments, where you could place the attachment. Look at how we're changing here, how we're changing the angulation. We're even exaggerating. We're exaggerating how we can make the correction.
Here's what I always run into when I'm talking about this. But you can't get skeletal expansion with a removable piece of plastic or printed nylon. Can you? Now, I was very skeptical about that. So I just kind of want to show you some of the first few patients I did on this. So here's case 1. I took the occlusal shots because I wanted to see what it was doing. At 21 days, look at that suture opening. And then at 56 days, it's filling back in, and the centrals are traveling back in just like you would see when you're maintaining an RPE. I mean, it's exactly like what I would see in my practice. So here's what it looked like in the mouth in this same patient. You can see that diastema opening up between those centrals. And actually, the very first patient I did, just because I wasn't sure what I was going to do, I forgot to tell the parents that they would probably get a big diastema. They come in, hey, she's a little concerned about this big space. I'm like, awesome, it's working great. Awesome. So now you got to remember to tell everybody that just like you would with an RPE. So, you know, it gets skeletal expansion. And, you know, I was questioning it when I first tried it also, but hey, once you try it and find out if it works. So this is what it looks like from the occlusal. Here's another patient. I did her a little bit slower than the first one, and you can see the suture opening, but after it holds, it starts filling back in, but you get the space, and then that suture fills back in. Same kind of arch shape change, space developing between the centrals. Here's another one. Suture just wide opening on this boy right here. When he started to, you know, into it in about 3 months, it was just cranking and looking just like I would see if I was doing an RPE. So you can see that diastema and the arch change getting wider. You don't see a ton of buccal tipping like everybody thinks you're going to get. So that, you know, that's it worked. It's skeletal.
You know, a lot of patients, and always surprised me at the clinic when the patients would ask, wait, let me take a voice of,
do you still take some new patients? Because the waiting room is full. So I thought maybe you don't take new patients anymore.
Your patients, this is what they think. They see that the waiting room is full. They think you don't take any new patients anymore. We always take new patients. This is how we stay healthy. We always take new patients. Your patients need to know that. Your team needs to know that. You will be surprised. You need to know that. You still need, tell your patients, don't keep us a secret. Don't keep us, the same thing I tell you, don't keep us a secret. Share with the others. Share with anybody who think that would benefit from our services. This is what you tell your patients. When is the best time to say that? When they give you a compliment. Oh, I like that so much. Oh, thank you. Wow, it's amazing what you did. Perfect. Make sure you don't keep us a secret. Please share with your friends, your family, your colleagues, everybody you know. We always welcome new patients, even more when they're referred by somebody like you. And we're going to take good care of them like we took and we take good care of you and your family. This is what you're doing. This is how it works. Because again, where are they coming from? Do you know yourself where your new patients are coming from? Is it more from word of mouth? Is it more from your marketing? How much you spend in marketing? Is it worth it? It depends where you are. It depends. Is it marketing that you do on social media? Is it marketing that you do? Maybe you're doing some mailing, maybe whatever. Where are they coming from? Maybe a reference from other dentists. Could be. You need to know, what are you going to do with these dentists who are referring you some patients? I mean, this is a colleague referring you a patient. It's an act of really a confidence. I mean, recognition from your peers. This is one of the things. So, what are your systems? Do you have some systems? Do you have some protocols in place? Does your team know about the protocols? What's your workflow? What are your systems? What are you doing with new patients? What are you doing with new patients? What are you doing with your regular patients? What's your just New patients. What are you doing with the iTero? Do you have or any scanner? Do you have a protocol for that? How does it work? Is it your iTero standing in a corner of a clinic with some spider web on it? I mean, yes, we have an iTero. Do you use it? What's the protocol? Does your team use it when they have time? When they have time? Or do you have a system? Do you have a protocol? What's your system for consultation? What's your system for finances? When you talk about finances, how does it work? Does your team know? What's your system with let's say you do clear aligners? What's your retention protocol? What is your follow-up protocol? What is your, when you insert new aligners, you start a case, how does it work? Your consultation, all these systems, all this flow, they need to know that, and everybody has to do it the same way. It's like a choreography. If we look at like this example in the ClinCheck, you see that if we rotate the teeth like this, look at the second molar will move forward. So the second molar moves forward, and these move, they distalize a little bit, and this one goes like this. Is this what you want? Maybe this is what you want, and maybe this is not what you want. Maybe you want the space to be completely here in between the two teeth. Maybe you want the space to be here between the first molar and the second premolar. So the way we're going to do that is we're going to lock the teeth in place. So when you right click on a tooth, you can lock that tooth in place. So we lock the second molar in place so it will not be able to go forward. Then we rotate the molar, the second molar stays there, and you see there's a space here on the mesial and the distal. Same thing on the other side. You have space on the mesial, space on the distal. And then I can decide how I want to move my molar. Now, if I want the space completely on the mesial, I can distalize the molar. I can block the second premolar also. And look, then I really can use the whole space for the anterior teeth. This is how you control your cases. This is called controlling cases. This is called taking the time to look at your case. Not doing this, very fast in between two patients, not letting the software or the technicians do everything for you. Because, this sentence we hear, trust the software. Don't trust the software. Trust yourself. Trust yourself. You are the doctor. If you have a problem with a patient, the software will not be there to help you. And the other thing you have to remember is that teeth do not look at the ClinCheck. They're not looking at the ClinCheck. They don't know where to go. So you have to apply the right mechanics, the right force, the right principles to bring them where you want them. And this is important. And this makes the difference. This is how you will control your case, because you should always be in control. And this is one of the, for me, this is what makes the difference between somebody who knows what they're talking about and somebody who are, following recipes and wishing that everything will go like it's planned, and how it works when everything works. But I'm telling you, there's only one way not to have any problem with clear aligners. Don't do any. Don't use them. If you don't use them, you won't have any problem. But if you use them, if you do cases, if you put your hands in saliva and you treat patients, things will happen. But this is how you learn. This is how you learn. Of course, you learn when you do courses like this. But at one point, you have to treat patients. You have to start cases. at the difference. So we have an optimized attachment on the right central for extrusion, and we're going to change the one on the left, the optimized attachment on the left. We're going to change it for a rectangular attachment, and we're going to bevel it the same way, and you will see the difference. So I remove the attachment. I just click on the attachment. You can click delete. You can bring it in the little trash can. Click on the attachment that you want to put. You go on the tooth. You just click again, or click and drag. It's going to put it there, usually like 3 millimeters. You can right click, choose 4 or 5. Then we choose a 5. We bring it down. We're going to increase the thickness. Increase the thickness. So we click on the attachment. We go on the green arrow. We increase the thickness. And then we're going to use the red arrow, and we're going to create the bevel. Now, if you compare the one on the left that we just created with the one on the right, I mean, just by logic, where do you think we can apply the best force? I mean, we have a lot more surface. So it's all about the force. It's all about the surface. Look at this. Look at the difference here. So we have the one on the left, the one on the right. So the left is a rectangular conventional attachment. The one on the right, well, the right of the patient, and just next to me is the optimized attachment. So look again at the difference on the surface. I mean, we have more than 2 times the surface. So it's like having more than 2 attachments side by side, more than 2 optimized attachments side by side. So this is something you have to think about, and you have to consider. Again, it's all about the surface. It's all about the force, because the force will be applied on the surface. Force will be applied on the surface. I have always this question: what do we say to a patient that asks us for a price? How much is Invisalign treatment in your office? Most dentists will say, don't talk about money on the phone. Never. Never give a price on the phone. I say, not true. Not true. Never say no to that question. How much is an Invisalign treatment? Oh, well, I cannot really give you a price. So you start with something negative. I will be happy to give you a price and tell you how much an Invisalign treatment is. I will be happy. But before I tell you how much it is, I just need to ask you a couple of questions to know a little bit about your situation. Okay. So can I ask you these questions? Yeah, sure. Okay. Are you a class 1, a class 2, or a class 3 patient? What type of occlusion do you have? You don't know. No, not really. Okay, fine. Well, then we'll go to the other question. So, what type of problem do you have? Do you have like more space in between your teeth, or you have like not enough space? You have like crowded teeth. Oh, I have crowded teeth. Crowded teeth. Okay, very good. How much space are you missing? How much space are you missing? This is what we hear. They have no idea. They have no idea. Are you a deep bite? What's the percentage of your deep bite? What's the percentage? What's your overjet? What's your overbite? You can, and this works with everything. Works with implants. Works with. You're not saying no. You're just showing them that you need this information in order to give a price. And it gives you a lot of credibility. A lot of credibility. Yes, it does. So when you see that they don't know what to answer, you say, well, you know why? This is why Dr. Reinhardt would like to see you. So if you come, not if, when you come for a consultation, we're going to look at all these things, and we're going to be able to give you the right price for you, because it would be easy for me to give you a price on the phone just to make you come in. But This is not how we like to do things here.
Here's something I kind of like to do just to see what's going on, if there's a lot of tipping or not. So this was her after 21 days. The scan, I like to measure from 3 points, from the lingual cusp, from the most lingual portion of the tooth at the gingival level, and then at the lingual embrasure at the gingival level, to kind of see how much of it is, tipping versus, the expansion. And you can see I expected, from the number of aligners she had, or expanders she had, 4.75 millimeters. And in those three, she had between 4 and 5.1 millimeters of expansion. So a little bit of tipping, but not much. And I've been seeing this hold true on pretty much everybody. It is usually a millimeter or less on any tipping that happens with these expanders. So, I was changing her every day, and then she kind of threw a wrench into the whole system here. And that's when she come back the next time with her next ones. It was about a week into it, and all of a sudden they didn't fit. And that's where I think they started slacking a little bit on wearing them. I saw like her and then the first 2 or 3 patients kind of followed the same scenario. So I went to changing every other day. So we had a little pause in treatment because I had to get some more expanders where she got off track. And then at 9.5 weeks, you're starting to see by now she's holding, and those centrals are starting to drift back together like you would in a traditional RPE. You can see the arch shape change. And the laterals, when you had the expansion, the laterals don't drift back as quick as the centrals do. And I think it's because they're right on that suture line when it starts to close back up. And you can see in the sutures now starting to fill back in with bone. And this is after her final amount of expansion. I expect her to have 5.75 at this point. And we have between 5.1 and 6.5 millimeters of expansion. So there is slight tipping, but when you look at the arch and the scan, it's like barely.
Yeah, that's it, barely. I mean, there's definitely a change in the arch shape. I mean,
quite honestly, I see that much. I see that much or more tipping with an RPE. So I've been really thrilled with that. So now here's another thing that I find pretty cool with your scan. You can actually see the palate. And especially if you're get into airway and you're kind of really looking into that to see the change. I don't have a really good fixed points to measure, but just looking at that, it feels like it's flatter and broader. And I'm kind of seeing that across the board. So I really like that for sure. And this was her like through the 3 time periods at time 1, time 2, and time 3, suture opening and suture filling in. And you can see as the centrals again drift back mesial as the suture fills in. So there's, at 20 expanders, it was at 3 weeks. We had 4.3 millimeters of expansion. Then we went through 24 or a few more expanders, which was 5 weeks more where we kind of got slowed down. So we had 5 millimeters expansion when I was looking for about 5.5. So, or 5.75. So it's pretty close. Pretty accurate. So she got 23 expanders, expected 5.75, got 5.4 in 5 weeks. I was happy.
Stefan, should orthodontic treatment be considered in patients with periodontal diseases? What do you say?
It's another test question.
No.
It's another test question. So the answer is yes.
Yes, it should. And why? Not because you saw that webinar tonight, but also because we are so good in our periodontal treatment. This is the truth. We can do Invisalign on patients because we can control our perio so well. And this is, without to bring closer the periodontist and the orthodontist specialist, see that as something very, very positive. Sure. Right? This is now where it goes together because the perio is so good to be treated those days. We have so many, great results with this. And this is, I mean, yeah. Also, with clear aligners will very likely improve oral hygiene and periodontal health. So it's gonna even help us on the periodontal, compromised patients. And we have now studies with Invisalign showing that compared to fixed orthodontics. So I mean, it will improve the occlusion. I mean, I had a patient who presented, that's my patient on the right side, with a Stillman cleft. So, I mean, the first thing you see, patients, what would we do? Inflammation control and then send it for graft. And what's going to happen a lot of times? We're going to fail. Half a year later, still recession, again recession, and so on. So, I mean, inflammation control was good. Second picture was much better. But then we did Invisalign. And then we did the graft. And now we don't want to say it's going to be, it's no magic. But at the end, it's the only good way to do it. Because if we have traumata because of occlusion, and this little root is always doing, a little movement while we are chewing, swallowing at night, a day, whatever, it's never gonna, have success at the end. That is for sure. And with a ClinCheck software, with maybe a CBCT on top, you can plan so precise. I mean, I was no orthodontist back in 20 years, but nobody could plan that precise. Never. Nobody could, right, Stefan?
That's the beauty of the tool. That's it.
That's it. And at the end, the combination of both will, for sure, motivate your patients. And they're going to motivate your patient to be a lifelong patient in your clinic, to do other treatments with you, to trust you even more. I mean, look at the patient who did that implant immediately. It will bring you money. It will bring you joy. I mean, it will bring you new patients because those patients, for sure, they will go outside and tell their story.
What is the future, you think, of clear aligners? How do you see the future? How do you see where it's going to go in 5 years, 10 years? How is it going to be for dentists in 10 years who decided not to integrate clear aligners in their practice?
Well, first of all, patients will know more about that. They already do because the marketing is strong, not only for us dentists, but also for the patients out there. And I think that it will be, a really important point for patients to see that somebody really offers everything, including that. I mean, that is for sure. And if you don't jump on that now, it's going to be harder and harder to really make that change maybe later. And the future, what I see is that we're maybe being able to produce our clear aligners into our own clinic by having a company what helps us with the planning, what gives us the digital tools to plan not only orthodontic treatment, but combined with perio, implants, resto, with everything comprehensive dentistry offers. And I'm pretty sure that it will come to that point that you have a status of a patient, new patient coming in or existing patient. And it's just about, AI will help us, and pretty sure ortho will, for at least 75 to 80%, be always one option. What is from the beginning, in the treatment plan. That's for sure.
I think this is why also the importance of integrating it now, because the other thing is that it's going so fast right now, like you said, with AI, with the technology, with everything, that if you do not go digital now and you don't integrate this now, the more you wait, the more it's going to be difficult, the more there's going to be things to integrate, not only about orthodontics, but about everything else. Learning the software, learning I see everything it can become confusing at one point if you're trying to do too many things at the same time. And this is,
I think so too. I mean, the companies do their best, but it's still confusing. Sometimes do I go this way, what matches with each other? So I think if you have from the beginning a company you can trust, a scanner, what is open for everything, maybe a lab also, what supports all the other softwares you're using. And I think this is a process that doesn't come overnight, and it will become more and more what's available on the market. So yes, absolutely.
But it starts with education. And you know what? When it comes to clear aligner education, the choice is clear. Institute. You've just had a taste of how the Clear membership can revolutionize your practice, giving you the tools and confidence to tackle cases with precision and ease. But here's the best part. Clear aligners are not just effective. They're a stress-free way to practice modern dentistry. They're profitable, they're fun, and perfectly aligned with the kind of life we all strive for. So imagine less stress, more time, and treatment option your patients love, your team enjoys, and that helps you build the practice that you've always wanted. So what about you? Are you ready for less stress and more fun? For a limited time, you can join the Clear membership and enjoy your first month free. No risk, no strings attached, just incredible value waiting for you to explore. And don't forget, the links to join the Clear membership and enroll in the MOCA 101 and 201 programs are right below this video. These programs are here to help you not only start cases, but confidently finish them with the perfection every dentist aims for. So when it comes to educating yourself in clear aligners, the choice is Clear Institute. It's time now to make the move, so click below, join today, and let's take your practice to the next level.